5 minutes to 4 here on Today, only on eNCA, DSTV Channel 43. My name is Cindy Mabi. I'm standing in for Bradan Moyane. Let's go to the story now. There are almost 1,000 unclaimed and unidentified bodies in Johannesburg and Germiston mortuaries. The Gauteng Health Department says 11 of their facilities are holding more bodies than what it can handle. And recent electricity challenges have made it even more urgent to see these claimed. So they're turning to technology. And yesterday, the department, in partnership with the Council for Scientific Industrial Research, in short, the CSIR, launched a new digital fingerprint system to help with identification. We're now joined by Gauteng MEC for Health, Nomantu Nkomo-Ralehoko. MEC, good afternoon to you and thank you so much for joining us. Just off air, you were expressing that it has been a very difficult 8 months for you in office. Nonetheless, it's gratifying because you feel you make an improvement to the living conditions and particularly access to health care in the department. How did we get to almost 1,000 deceased or bodies not being claimed? Good afternoon.
Good afternoon, my dear. The backlog came in 2020, 2021, 2022, and I think in all our areas in the department we have been having that backlog, because I'm sure if you are following us and you remember at some stage I was telling you about the surgical backlog that we are having. So even this one, it's part of that process. But all those areas, when we arrived in the office, we just agreed that let's make up a plan in all the areas where we have a backlog. Then this one, it's part of those critical areas. Because remember, some of the people that are there are people that were unable to identify them, but we are working very closely with the municipalities. And at some stage, after 30 days, because sometimes they say 30 days, you must dispose some of those bodies, working with them. But even that process, it takes a bit of time because there are areas that we must do follow-ups on that. But we do publicity, and we felt that it's not helping us. And then we decided that let's go for digital then. I think this one is going to help us because since we've started digitizing some of our services, especially on the mortuaries now, we will reduce the backlog that we are having.
And also you are working in partnership not only with the Council for Scientific and Industrial Research, you also have the Center for Public Service Innovation members, or rather the Home Affairs Department, South African Police, National Credit Bureau, really reaching out so that you can expedite the identification of the deceased. So how far, or the level of success that you've had so far in this process?
It has been very successful because yesterday they were handing over now all the tools to us as a department, and we will be working even with them at Foreign Affairs because now the embassies, especially in Zimbabwe, they started to raise their hand. They want to work with us. All the SADC countries, they are excited about this problem that we are doing. So we will be doing the integration to all the SADC countries now. So definitely Foreign Affairs must be part of the team. But it's quite good because everybody feels that this is the necessary tool that we must be using now to achieve what we want to achieve as a department.
And MEC, of course, death in itself is not a pleasant subject to talk about, but nonetheless, we know that it's inevitable. And we're also sitting with an issue of possibly unidentified illegal migrants, or even people who have gone missing and their families have not claimed them. So how do you reach out over and above what you've done to ensure that families are given the opportunity for a dignified burial of their loved ones?
You are right, and it's a very sensitive thing, but I think once they know now their person, we have found that person, they get excited about the work that we're doing. And we have a database of all of them now. Hence, it becomes easier for us to inform the family members that we have your body here. And that's why we want to make sure that we go to all the institutions and we're able to know who's here, where does it come from. We're not going to wait until the person comes, and then so that we are able to communicate the information to the relevant person. It's quite exciting, Sandy, when you see it happening in action, because within 2 minutes, you know that where is this person come from, where the person was born, all the necessary details that we find in the identity document of a person. So we are really excited about it, and we are happy with the work that already the team is starting to do. And we want to aggressively train all the staff members so that everybody that is working at the forensic pathology services offices is able to assist a person when they are there in terms of this identification.
I was going to come to the training, MEC, also in the sense that this does give a more compassionate approach to the forensic pathological services, particularly, as you say, this is a very sensitive time for family members to deal with, let alone if the bodies are not identified or processed speedily enough. The issue of load shedding and in doing your work or the pathology services, how has that impacted you, let alone the water situation, etc.?
We have a backup system of generators in all our facilities that we have installed. Hospitals, and including the FPS offices, we have those generators that are running on daily basis. Once there is load shedding, it kicks in within 30 seconds. So because we, at some stage, we wanted to make sure that our fridges doesn't get affected. Hence, we had those generators. But we have that backup, including the water. We have a backup even on water. I'm sure we didn't hear even now that there is a facility that has been affected, because the ones that will always have a problem, which is Helen Joseph, we have plans even on that one of making sure that we have a backup plan on water. But in the FPS offices, we do have generators.
Yeah, and what is the cost burden to not only the health department? I suppose this would not only be in Gauteng, it probably stems across the board. The cost burden of family members or deceased who have not been identified or claimed?
There is cost involved, but sometimes we meet them halfway, because we do the interviews and assessment. You can see a family that is really in need, that can afford even to pay the amount of money that is needed, especially even on the exhumption of the bodies. Remember, sometimes we had to bury some of the people that were not aware, and then when now we're supposed to do that, we definitely make sure that we work with the Department of Social Development in identifying the families that we know that they are in need. So we do meet them halfway, because we know not everybody will be able to afford definitely the money. Because I know just to exhume one body, you have to pay about 17,000. And it's a lot of money to some of the families. Then we do assist those families. Even recently, I think 2 days ago, I had a case of a family that can't afford, but they want to exhume that body. So we didn't say we will stop. We have to do something as a department in assisting the family.
And the body being exhumed, is this because there is suspicion that there may not have been an autopsy done and that the cause of death might have been foul play? Why would, in your case now, these families want the bodies exhumed?
Sometimes they were not aware of the family member that is lost until it's late, and then they realize that it should be that person. So we are forced to go and exhume that person then, if it's a situation like that. So in fact, it's a similar case that I'm talking about, the one of these people that are unable some of these people that are unable to find their family members. It was the time that we didn't have this system. So now, because we have the system, we're able to do that. We went to the database and we told the person that this person was buried 3 months ago, and now we're assisting them to exhume the body. So that's another problem that we're experiencing as a department. But now, because we have this system, it will be easier for us not to allow anybody to be buried without informing the family members or tracing that. But again, and if you have seen in our social media, we have people that are in hospitals like your Tembisa and your Gauteng Hospital, that we always publicize them, that so is there. Please, if you know the family, inform them. But now it's going to be easier for us, because once we check with through the fingerprints, we will know where the person did his or her ID.
MEC, I'm afraid we're going to have to go, but thanks indeed for your time. That's Gauteng Health MEC Nomantu Nkomo-Ralehoko. Now going